Hello. Thank you so much for joining AARP and Blue Star families today. Thanks for helping us shine a light on the courageous hidden heroes in our military-connected community. If you are new to Blue Star families, welcome. I'm Kathy Roth-Duquet. I'm the founder and CEO of this organization. I started Blue Star Families 12 years ago with friends because, like many military spouses, I often had a hard time connecting in the communities where I lived. I created Blue Star Families to empower military families to thrive, because when we thrive, we can continue this mission of serving our country. We strengthen families by connecting them to their civilian neighbors and to create vibrant communities of support. We created our Homefront and Frontlines Town Hall series to give you information in an easy-to-get format. Today, in partnership with our wonderful friends at AARP, we're excited to present our Military Caregivers Celebrating America's Hidden Heroes Town Hall. This town hall will foster a circle of support and provide much-needed resources for you, our military caregivers, and for the support organizations that help them. You are all a truly special group in our military-connected community. You're called Hidden Heroes because so many of our military caregivers do so much work with very little recognition or support. During this hour, we're going to focus on the many shapes and definitions of a military caregiver. I know that so many of you are caregivers yourself or come from an organization that supports caregivers. We want to give a shout out to some of you: Elizabeth from Arlington, Virginia, Cindy from Linwood, Washington, John from Midvale, Utah, a very varied group, so many from so many parts of the country. Please put your location in the chat and your name. Whatever role you play in our caregiving community, we hope that this town hall will give you some relief that you aren't alone, provide answers to any issues or stressors you may have. Engage with us. Let us know how we can support you. There's 5.5 million military and veteran caregivers in the country today. And from Blue Star Families data, we know that many of you feel isolated and lonely, more so than your non-caregiver peers, but you don't have to be. And that's where our fabulous group of experts comes in. We have a really wonderful panel for you all today. Representatives from the Department of Veterans Affairs, our corporate and nonprofit partners, CareLinks, the Elizabeth Dole Foundation, Rosalind Carter Institute, and the Wounded Warrior Project, who are leading the way in supporting the caregiving community. Before we get to our panel, you have the amazing opportunity to hear from Blue Star Family's very own Dr. Jessica Strong. Dr. Strong is going to share exclusive military caregiving data that hasn't been shared before. We think it will highlight many of the issues you or your loved ones have been feeling, and we're really excited to reveal it for you here today. Jerry Maples, another wonderful colleague of mine at Blue Star Families, is going to share her own caregiver story. And finally, at the end of the hour, we surprised a few caregivers with some great surprises in honor of the month of the military caregiver, and you won't want to miss their reaction. To start off this hour, I am super excited to welcome Joanne Jenkins, the CEO of AARP, to say a few words. Joanne, thank you for bringing the might and strength of this enormous organization, AARP, to partner with us. We really appreciate AARP's leadership in the caregiving space as a whole, and particularly the opportunity to collaborate within the active duty and veteran caregiver community. It has really been an honor to grow our relationship with you over the past year. Thanks for your support and partnership. We've been able to support the entire military-connected community in new and innovative ways, thanks to the partnership of AARP. Joanne, take it away.
Hello, I'm Joanne Jenkins, CEO of AARP, America's largest membership organization serving Americans 50 and over, including over 5 million members who are current or former military service members. Thank you for attending today's National Town Hall focused on veteran and military caregivers. You are the hidden heroes serving on the front lines. When you're a military veteran caregiver, you start younger and you care longer. You manage situations other family caregivers don't deal with. That's why AARP provides plenty of free tools and resources to help you on your journey, like our Military Caregiver Guide and our new financial guide for veteran and military caregivers. We also have other free resources for veterans and military on caregiving, fighting fraud through Operation Project Veterans, and finding work and jobs at aarp.org/veterans. At AARP, we're on a mission to support veterans and military families. Thank you again for being here.
Thank you, Joanne. We have really enjoyed strengthening our partnership with AARP. I appreciate AARP's collaboration, not just with us, but throughout the veteran and military nonprofit space. I look forward to watching our partnership flourish. It is really an honor to work beside you. Now, I'd like to transition to our friends at the Department of Veterans Affairs. The VA, of course, has a long history supporting the caregiving community, but particularly in the last several years. They know that caregivers are the linchpin in ensuring the health and well-being of our veterans. It's my honor to welcome one of VA's newest leaders, but a longstanding friend of ours, John Boesler, to speak with all of you today. John serves as the Chief Veterans Affairs Experience Officer at the U.S. Department of Veterans Affairs. In this role, his top priorities align with Secretary McDonough's two main goals for the Department of VA: increase access and increase outcomes for the veterans they serve. Having served in the U.S. Marine Corps as a non-commissioned officer, as well as various government and military nonprofit roles, John is really uniquely and well-positioned to meet and exceed these strategic goals. John, thank you really so much for being here with us today.
Hi, my name is John Boesler. I wanted to say thank you to Blue Star Families, AARP, and all of the leaders involved in having me today. Just a few short months ago, I began my tenure at the Department of Veterans Affairs as the Chief Veterans Experience Officer. And it's my honor to talk to you today about the Veterans Experience Office and how we value and support military veterans, caregivers, families, and survivors. Many of you I am familiar with from my past life, and many of you I will get to know as we build relationships and partnerships that enable positive outcomes, reach those underserved, and bring transformative solutions to our veterans. We must work together to serve all veterans, their families, caregivers, and survivors. Every partnership we make will be supported by a simple principle that it increases veterans' access to healthcare and benefits, and it improves outcomes for them. VEO supports VA as the Secretary of Veterans Affairs Customer Experience Insight Engine and a shared service to partner with, support and enable and VA administrations and staff offices to provide the highest quality customer experience in the delivery of care, benefits, and memorial services. To all transitioning service members, veterans, their families, caregivers, and survivors. Trust in VA has reached nearly 80%, and our goal is to keep raising the bar by providing excellent customer experiences that are easy, effective, and with positive emotional resonance. With 85 active V-Signal surveys, we've sent over 39 million surveys and received almost 7 million responses and 2.5 million free text responses. Our highest priorities will be VA's three core responsibilities: providing timely, world-class healthcare, easy access to benefits earned, and honoring our veterans with a final resting place that's a lasting tribute to their service. In addition, we'll do everything in our power to help veterans, families, caregivers, and survivors get through this pandemic, help them build civilian lives through education and jobs, ensure that VA welcomes all veterans, including women, veterans of color, and LGBTQ veterans, work to eliminate veterans' homelessness and reduce suicide, and build trust in VA through excellent services and benefits we strive to provide each day. Through the Veterans Experience Office and use of our data, tools, technology, and engagement strategies, we listen to what veterans and their caregivers have to say about their experiences. And then we deploy innovative strategies to address concerns and challenges. We know that there are several concerns we need to address. For example, delays in mail order prescriptions caregivers not being able to accompany veterans to appointments, difficulty with pain management, unprofessional staff, lack of information on COVID-19, and children under 15 unauthorized to accompany veterans into VA facilities. VEO is the listening engine that will enable VA to provide excellence and customer experiences for veterans and caregivers to get what they need. We listen through the use of our V-Signals capabilities that are then used for program improvements and service recovery. Today, VA serves tens of thousands of caregivers in both incredible programs. I wanted to mention just a few of the veteran caregiver efforts we have supported in VA. We've developed a caregiver and survivor quick start guide as a one-stop shop to access VA services. We've conducted outreach and awareness support for the Mission Act and the expansion of the program of comprehensive assistance for family caregivers by reaching nearly 12 million veterans and their families through our Vet Resources e-newsletter on a weekly basis. Karma enhancements for veterans and their caregivers, enabling veterans to choose home, supporting respite relief for caregivers, and geriatric service pilot programs. Supporting key recommendations from the Veterans, Family, Caregivers, and Survivors Federal Advisory Committee, the first of its kind in VA history that's focused on this population, led by Senator Elizabeth Dole. Strategic partnerships with groups such as the Elizabeth Dole Foundation, Red Cross Military Veteran Caregiver Network, Rosalind Carter Institute, Wounded Warrior Project, AARP, and TAPS. We also host Veterans Experience Live Q&A events for caregivers and survivors, which help provide subject matter expertise responses and reaching hundreds of thousands of people. Veterans, families, caregivers, and survivors are so important, and we are proud to serve all we can in VA, but we can't do it alone. With your partnerships, we can achieve collective impact and truly help more veterans and their caregivers. Thank you for your time today. Now it's my pleasure to turn it over to Dr. Jessica Strong, Blue Star Family's co-director of applied research.
Thank you, John. We look forward to hearing more about the VA's robust customer experience plan. So let's start, though, with what we know about caregivers and caregiving in both active duty and veteran families. We have gathered the data that we have collected over the past year on caregiving families from a variety of research projects. As I'm presenting these slides, you'll see the research report that the data is drawn from down in the bottom right-hand corner. We're also excited to share with you today a little sneak peek of some of the data from our forthcoming deep dive report on caregiving in partnership with the Rosalind Carter Institute for Caregivers. RCI collaborated with us last year to lend their expertise and develop some caregiving questions for our 2020 Military Family Lifestyle Survey. So together, we're working on a deep dive report focusing on caregiving from that data. It's going to be published later this summer. And so when you see the 2020 MFLS, Military Family Lifestyle Survey logo in the bottom right-hand corner, you will know that that is part of that sneak peek. So let's start with the demographics of caregiving families. Caregiving is common in both active duty and veteran families. In active duty families, it's most commonly the spouse of a service member, but in veteran families, it's most commonly a veteran, but a good proportion are also spouses of veterans, so they're dual veteran couples. Most caregivers, unsurprisingly, are female, both in active duty and veteran populations. Here you'll see the race and ethnicity demographics of our caregivers. They generally reflected the race and ethnicity of our whole sample in that most of our respondents, both caregiving and non-caregiving, are white, non-Hispanic service members or spouses. They do start to differ a little bit when we talk about active duty caregiving families and veteran caregiving families when we look at who they're caring for. So caregivers in active duty families are most commonly caring for children, whether with or without special needs, but 1 in 5 are also caregiving for a parent or a grandparent. That is also the case in caregiving families in veterans. Most caregivers in veteran families are caring for a spouse or partner who's a veteran, but they're also caring for children and a parent or grandparent. So there's a lot more diversity in the type of people, the care recipients in veteran caregiving families. We also want to share the reasons, the care recipient's reasons for needing care. Most commonly, it is because of an emotional or a mental health concern, including things like TBI, PTSD, depression, or other mental health concerns. But there are also some other long-term and short-term physical conditions for which the care recipient needs care, both in active duty and in veteran caregiving families. One of the common concerns to both active duty and veteran family caregivers are concerns about respite and backup care availability. You can see from this chart that few active duty and few veteran family caregivers report that they have enough opportunity to take respite from providing care or to have a backup or substitute who can provide care for the care recipient when they need. You'll see that fewer than half of either group have the respite or backup care they say they need. Now, as several of our panelists can attest, caregivers have been particularly hit hard by COVID-19. In the early days of COVID, between May and June 2020, Blue Star Families and the Association of Defense Communities conducted the Resilience Under Stress Study, affectionately called RUSS, as part of our COVID-19 Military Support Initiative. This study focused on the community characteristics that can support individual and family resilience. So when we look at the caregivers in that group, in that data sample, a greater proportion of our caregiving respondents reported major or severe impacts of COVID-19 in almost every area that we asked about. Caregivers reported that COVID-19 had impacted their happiness and their mental health the most, but it had also impacted their employment and their financial situation. In addition to feeling more major or severe impacts of COVID-19, caregiving active duty families reported that they had significantly less social support in their communities. They had fewer friends, fewer contacts in the community of whom they could ask for a favor, and significantly greater social isolation than their non-caregiving peers. Each of these points was statistically significant, so it's a big difference. Here, you can also see that they report less community support. Just as they perceived fewer social resources, caregiving respondents perceived less capacity for support from the community as a whole. Caregiver family respondents said they had significantly less social support, less belonging, less military family lifestyle cultural competence, poorer community leadership, and poorer community engagement. All of these are critical protective factors to support resilience. So if you can see that each of these items is a component of resilience, and taken together, caregiving families may be at a disadvantage. At the same time, during COVID-19, caregivers often had to provide more assistance than they did before. 1 in 5 caregivers, both active duty and veteran families, reported that they assisted their care recipient more during COVID than they did beforehand. Let's talk a little bit more about caregivers' financial needs and how COVID impacted those. As I mentioned earlier, we know that a greater proportion of caregivers reported COVID-19 had major severe impacts on their financial or employment situation. Unsurprisingly then, a greater proportion of caregivers in our 2020 Military Family Lifestyle Survey are reporting that their financial situation causes them stress. You can see it's significantly greater than their non-caregiving peers in both veteran and active duty families. Continuing this trend, both the Military and Veteran Families Financial Needs Pulse Checks, which we fielded in November 2020 and March of 2021, also demonstrated a greater financial need in caregiving families. This chart, you can see, illustrates the percent of families reporting that they had no immediate financial needs. As you can see, fewer caregivers, both including active duty, veteran, and National Guard families, reported that they had no immediate financial needs when compared to their non-caregiving peers. And while both active duty and veteran caregiving families reported having immediate financial needs at higher proportions than their peers, the types of needs that they had differed. Consumer debt was the top financial need for active duty family caregivers, while food and prescriptions and other key essentials took the top spot for veteran caregiver respondents. As you can see, collecting and analyzing data around our military caregivers is so important, and we need your help to do it. While we are reporting here data from our 2020 Military Family Lifestyle Survey, our 2021 survey is currently live and fielding, and it's available now. So by providing your experience, we can and will share your issues and challenges with people and organizations who have the power to advocate for and implement change. Now, to bring this data to life, I'm honored to introduce Blue Star Family's very own Dr. Jerry Maples, who will share her family's personal journey. I know that her journey will resonate with so many of our military caregivers. Thank you for joining us today. We hope that today's event helps you know that you are not alone and that our partners provide you with the resources that you need.
I am the spouse and caregiver to my husband, Robert. I've been my husband's caregiver now since his return home from Operation Iraqi Freedom in 2004. It was shortly after he came home that I started noticing the signs of something wasn't right. I made that initial phone call for help, and was told, honey, I can't help you because your husband is no longer in the military. And at that moment, I was frightened. I was scared. I was lonely. To be honest, I didn't even know I was a caregiver. I had no idea. I just went into action.
While not often talked about, there are actually 5.5 million military and veteran caregivers in the U.S. today.
My kids really had to learn to live with a father who had these invisible wounds. When you say that your loved one is a wounded warrior, they expect to see a missing limb or some kind of scar. He doesn't have those visible scars.
Lack of understanding and support is a real challenge for our caregivers, especially those dealing with invisible injuries.
In 2009, I decided to go back to school, and I took that opportunity to really understand what my husband's condition was. I wanted to know more. I was eager to know the answers to the questions of, why does he get angry? Why does he get frustrated? What happened to him that made him the way he is when he came home? Along my doctoral journey, I decided to tell my story as a military caregiver. Through my study on my dissertation, I became familiar with Blue Star Families and their annual Military Family Lifestyle Survey. I began using that data right away. Today, I'm a Blue Star Families chapter director, and I love that we have a program for caregivers to provide support and connections to folks like me.
We knew that our caregivers needed to have the support, that isolation that a lot of our caregivers feel on a regular basis, and then times 100 when you talk about the pandemic. We recruited 50 caregivers to take part in our cohort. Over this year, they will take part in 4 virtual workshops, and they receive caregiver boxes along with those, with items in them that complement the event. A lot of times we use them during the virtual workshop. It's a lot about self-care. We know that our caregivers are always caring for somebody else, and they a lot of times put their own self-care to the wayside. The coffee chat program is awesome. It's an opportunity for caregivers to meet at a local Starbucks in their community, and with a free cup of coffee on Blue Star Families, they get to connect with other caregivers in the community and also community partners. It's really important to me for them to feel like they have somebody that's going to support them, that we at Blue Star Families are looking for ways to get them involved in their community, make sure that they too are taking care of themselves, because I just want them to know that they're not alone.
I was lonely for a really long time, and to be able to find a community like I have now is a blessing, because I'm not alone anymore.
Thank you for sharing your story with us, Jerry. I don't think I can say this enough. You're an inspiration to everybody, both inside and out of the caregiving team. And we know that so many of you at home share similar paths as Jerry. So if you haven't heard this recently, thank you, and you are an inspiration. Now, for the moment you've all been waiting for, I am so excited to welcome Amy Goyer, AARP's caregiving expert and a close friend of ours here at Blue Star Families. Amy is the author of Juggling Life, Work, and Caregiving, as well as a nationally known writer, speaker, and consultant specializing in caregiving and family issues. She's a passionate champion for family caregivers and has been one her entire adult life, caring for her grandparents, parents, and sisters. Amy, thank you for your continued support of Blue Star Families' research efforts. We are so excited to collaborate with you and the AARP team again today for this important caregiving event.
Thank you so much, Kathy. Thank you for inviting me to join you today. It's always an honor to collaborate with Blue Star Families. You know, I'm a big fan of the work that you do and the support that we together are providing for military and veteran family caregivers. As you know, Kathy, this is an issue very near and dear to my heart because I cared for both my grandfather, who was a veteran of World War I and World War II and the Korean War and retired as a major in the Air Force, and my dad, who was a veteran of World War II. He was in the 10th Mountain Division in World War II, and then he served during the Korean War as well. And I cared for Dad. He had Alzheimer's. It was more than a decade of care. He lived with me for a great deal of that time. And so I have a very close connection with military and veteran family caregivers. So I'm really glad to be here today and be able to be a part of this really important event. Now, I've lived this, and it's an issue as I said, very near and dear to my heart. And it is, I know, for our esteemed panel as well. So many of you are just so incredibly dedicated to what you're doing. So it's really an honor to be able to introduce you all today. So I'm going to start with that. First of all, I'm going to let you know that we have a number of panelists. I'm going to introduce them, and then we're going to get into discussion. Starting with Meg Cabot. She is the Senior Advisor for Families, Caregivers, and Survivors at the VA. Meg is a licensed clinical social worker with more than 25 years of experience supporting America's service members, veterans, and their families. Ms. Cabot is currently serving as the Senior Advisor for Families, Caregivers, and Survivors in the Office of the Secretary at the U.S. Department of Veterans Affairs. Welcome. Thank you so much for being here, Meg. And we also have Dr. Colleen Richardson, who joined the VA in 2010 and serves as the Executive Director of the Caregiver Support Program. I'm a huge fan of the Caregiver Support Program, so I'm really glad that you're here today. She earned a behavioral science degree from Glenville State College, a Master of Science and a doctorate in clinical psychology from the Florida School of Professional Psychology. Thank you for being here. As I said, I'm a big fan. The VA Caregiver Support Program helped me a lot when I was caring for my dad. So thank you for all that you do. We also have Sherwin Sheik, who's an old friend of mine. We've known each other for quite some time now. He is the founder and CEO of CareLinks. CareLinks has been on a mission to leverage technology to dramatically improve the entire caregiving experience, really, so that patients can age at home safely with dignity and grace, and caregivers can find support. We are so happy to have you here with us today, Sherwin. And like I said, it's great to see a familiar face. Steve Schwab is the CEO of the Elizabeth Dole Foundation. And again, an organization that we've done some great collaboration with, and again, very near and dear to my heart. And that role that Steve has spearheads the country's preeminent organization that is empowering and supporting and honoring military and veteran caregivers. He's a national leader and a voice for the nation's millions of military and veteran caregivers and their families. So it's great to see you again, Steve. Dr. Alexander Balber, it serves as the director for the Warrior Care Network and Independent Services at the Wounded Warrior Project. In addition to this position, he currently serves in the United States Navy Reserve as a Medical Service Corps officer, hospital healthcare administrator. Thank you so much for being with us today. And Dr. Jennifer Olson serves as the executive director of the Rosalind Carter Institute for Caregivers, which promotes the health, strength, and resilience of caregivers throughout the United States. She holds a BA in biomathematics from Rutgers University, an MPH in epidemiology from the George Washington University, and a doctorate in public health from the University of North Carolina. Thank you so much for joining us, Dr. Olson. Really important work that RCI is doing as well with family caregivers. So to begin our conversation, I want to go back and start with Meg Cabot. She's the Senior Advisor, as I said, for the Families, Caregivers, and Survivors at the VA. Although the effects of the COVID-19 pandemic can be felt in all aspects of life, Blue Star's Families research has shown that active duty families with caregiving responsibilities reported more intense impacts of COVID-19 in many areas compared to their non-caregiving peers. So we have this active duty statistic, but what are you seeing in terms of the veteran community, Meg? How does the VA respond to the impacts of the pandemic on veteran family caregivers?
Well, thank you, Amy, and thank you to Blue Star Families for inviting me to be a part of such an important panel. I think it's such a good question. Caregiving is often, as you know from firsthand experience, such an isolating experience. And I think when COVID-19 hit, we all sort of shut down and isolated our families as much as we could. So for individuals like caregivers who were already feeling isolated, it became even more difficult and even more complicated. Caregivers were worried about their own health, worried about the health of the veteran that they love, that they're caring for, worried about the health of others in the house, and potentially older family members. All of the same things that that we all were feeling, but at such a more intense level. So, and especially early on, when we weren't really sure about transmission, we weren't really sure about mask wearing and those kinds of things, it was very difficult for our families, especially those who were providing a lot of hands-on care. And I think one reaction early on was to stop anyone from coming into the home, which made things even more difficult for caregivers who had come to depend on outside folks coming in, whether that be a neighbor or a friend who could offer them a little bit of time away from their caregiving responsibilities, or potentially a professional caregiver to come in and provide some direct hands-on services. Many of our families just stopped all those kinds of services. So early on, VA really focused on high-risk veterans, the veterans who required a lot of hands-on care, talked about backup plans, contingency plans, did a lot of phone work. We tried to do a lot of outreach around different ways to be supportive and to get some assistance. We actually changed some of our programs and policies. For example, one of the requirements in one of our caregiver programs is home visits, and we changed that requirement so that those visits could be done over telehealth. VA actually provided a lot of devices, iPads, iPhones, those kinds of things to veterans, and they were certainly used by caregivers as well so that they could continue some of the treatment that was going on and also get some support and mental health services as well. We also partnered with lots of different folks, including the Elizabeth Dole Foundation, who is here on the panel as well. And the Wounded Warrior Project to do some specific webinars around different ways to support caregivers, but also to provide some respite. And we did this with Sherman and his folks at CareLinks to provide respite. And when it was safe to do so, and when caregivers felt safe to bring someone into the home to provide them some free services. We also focused a lot on personal protective equipment, PPE, in the home and helped caregivers get that PPE if they needed it so that they could use it themselves, or that or that those who were coming in to help them could use it. And then what was really exciting for me is that in January, we were able to announce that we could provide testing and vaccination for a specific group of caregivers in one of our particular programs. And then shortly thereafter, we were able to provide a vaccine to all caregivers, which is really an important part of our mission as we support those who support veterans.
Wow. So it sounds like the VA really stepped up and has done a lot of great things. You know, the vaccines, I heard from a lot of caregivers who were very excited when they learned that they could get their vaccines via the VA, and also the improvement with telehealth.
Mm-hmm.
I think, you know, that the getting the devices that people needed in order to be able to carry out those telehealth appointments, and as you say, sometimes communicate with their caregivers was
right.
Really crucial.
Absolutely.
Really made a big difference. So thank you for all that. I know you've been working really hard, I'm sure, over the past year to get these really practical supports in place for family caregivers during the pandemic. Thank you so much. I'm going to move on now to Colleen Richardson, who's the Executive Director of the Caregiver Support Program. As I mentioned, I'm a big fan because the Caregiver Support Program, you know, was one of the first places I went when I was caregiving for my dad. And not being a career military, my dad, I didn't really know much about the VA and how to navigate, and they really helped me a lot. Now, we know that PTSD and combat stress and traumatic brain injury is a top issue for veteran family caregiver respondents to the 2020 Military and Family Lifestyle Survey that Blue Star Families does. We also know that almost half of the veteran family caregiver respondents, about 48%, are providing care for a recipient who has emotional or mental health problems that include TBI and PTSD and depression, et cetera. How does the VA Caregiver Support Program help families managing these really invisible wounds that people can't see, but they're very intense and sometimes very challenging caregiving.
So thank you so much, Amy, for that question. And thank you, Blue Star Families, for having me here today. So VA is definitely seeing an uphill trend in the number of veterans who report needing assistance with emotional or cognitive function, such as coping with memory loss, anxiety or stress, et cetera. So as we all know, invisible wounds, we can't always see them, right? PTSD, et cetera. That's why it's really critical for our healthcare teams to include caregivers as partners in veterans care, including taking the very important step of asking veterans if there's someone who helps them at home in order to help us engage and support caregivers. One of the things that VA is really committed to, and I'd love to give a shout out to Elizabeth Dole Foundation, who we've been partnering with on this, is the Campaign for Inclusive Care. So we really believe in bringing those caregivers into the appointments with the veterans. I mean, they're the ones who care for those veterans outside of the hospital walls. And we really want to know from them what they're seeing and how to engage them within providing care to our veterans. So their input of what's going on is important to us. So with that, what Caregiver Support Program does to support our families is our staff are made up of clinical providers. So we have social workers, psychologists, nurses, et cetera, at every VA medical center. And they're ready and available to assist our caregivers either in group formats or in one-to-one individual sessions. These clinicians have training and background in the area of mental and emotional health and well-being, and really can provide support to caregivers with strategies, skills, and connection to the various resources that our program offers through two of our national program offices, as some of you are familiar with. I think one of the neat resources that we do is called the REACH VA Caregiver Program. And so REACH stands for Resources for Enhancing All Caregivers' Health. And so REACH VA provides general coaching, but it also provides very specific coaching, so specific to that veteran's particular diagnosis, such as PTSD. So really training our caregivers on how to manage signs and symptoms of PTSD, which a lot of people just don't know how to do. So we teach our caregivers on how to do that. We help them target any challenges that they have, identifying and developing skills and strategies to assist them in the care that they're currently providing to those veterans.
You know, those are some really critical supports. I just recently was referring someone to your PTSD resources on your website. What's that website address? Like, is it just slash PTSD?
Yeah, so we have several websites that we'll go ahead and probably put in the chat for everybody so that they can have access to them. We have several that we'd love to share with everybody. We have several VA suicide prevention toolkits for caregivers. We have the VA caregiver website itself. We have the caregiver support line, which teaches and runs several classes a month for everybody. So we're happy to share all of those resources at everybody. They're free, they're open to anybody who's interested in participating, and we'd love to see people start utilizing our resources.
That's fantastic. Really, they're really vital resources. And, you know, it can be so isolating being a caregiver. So knowing that there's those resources out there and being able to connect with them is so key. So all of you who are watching, please check the chat and look for those links. I'm going to move now to Sherwin Sheik, who's the CEO of CareLinks. The Blue Star Family's 2020 Military and Family Lifestyle Survey showed that only 4% of veteran family respondents and just 2% of active duty family respondents reported that their community had outstanding caregiver respite and support programs. That is not much. It's so incredibly low. We know that last year you started trying to do something about that, and you announced a partnership with the Elizabeth Dole Foundation and the VA to provide respite care for military and veteran family caregivers. Why is this so important now, and what do you hope to achieve with this really transformational gift?
Well, thank you, and really honored to be here and talk about just the importance of respite care, and just really honored with the partnership that we have with the Elizabeth Dole Foundation, the VA, and the supportive partners who got us here. And last year, the pandemic, as Meg was talking about, impacted so many different families in so many different ways. And CareLinks, we're an in-home, tech-enabled in-home care provider. We have over 500,000 providers nationwide. We have over 1.5 million million members from Medicare Advantage who access the network to look for care. And that's on the civilian side. And I was participating in the panel discussion with Steve and Kathy, and hearing about what military and veteran family caregivers were going through right around end of March, early April. And this is at the beginning periods where people, again, we didn't know what was going on. Families did lock up in isolation. Now you had family caregivers who were looking after loved ones. Children, schools were shut down. They're having to juggle their own jobs. And I was just hearing it so much from the clients that we served, and then also on this discussion, just how much strain that put on these family caregivers. And fortunately, our parent company was very generous, going, Sharon, can you make an impact? And when I heard of what was being discussed, I really saw an opportunity to give back during the pandemic. And that is for giving these family caregivers a break, because they were at a breaking point. And it wasn't just, and on the military and veteran family caregiver side, they're dealing, it's different type of stress than the civilian caregivers, because as the doctor was discussing, it's a lot of behavioral PTSD things that they're having to manage, which is a lot more complex. And I wanted to find a way to serve. And so we're really honored we were able to partner with the Elizabeth Dole Foundation and with the VA to get the word out there. AARP was a part of that as well. And I'm really proud of the statistics that we have. I mean, when I looked at the CStat that the team reported on, it's 4.99 satisfaction score out of 5. And this is a nationwide program. And these are finite number of hours, 24-hour benefit. And we start off in the hardest hit COVID areas. And then EDF came back going, we want to go nationwide. I'm like, let's do it. And we went, and it's just really glad we were able to help these families in their time of need to get respite. And one of the KPIs they were tracking was, did we actually influence reported health? And what was shocking to me was they asked a question, the team did, EDF, on what they were, the reported health that they had before COVID, and it was like 80, and then what they reported a score of 80, and where are they today? And it was like 43 score out of 100. And then after they got that respite break, it was close to 95. And it's a meaningful change in their reported well-being by being able to take care of themselves. When you actually figure out, when we dissected what they're actually doing with that time, they're taking care of themselves. They're getting out there, giving themselves their own mental break, actually going, taking care of themselves from the doctor, getting doctor's appointment. And I'm just honored we played a role, and we want to continue to help serve this community. And it's unfortunate we had to go through that experience, but I think with this, a lot of great insights came around of how we can properly launch services in a collaborative way to really impact quality of life.
Absolutely. You know, I can certainly attest that getting some respite when you're in that place of desperation, and sometimes so overwhelmed you don't even know what you need, but a break is often what we really need the most. And as you say, can make really a transformational difference in an individual caregiver's life, just to have some help. Yeah. And hopefully to get that break and do some things, some self-care, or even just to have the mental knowledge that there's someone else there. You know, it's not just all on you, even if you don't leave the home. And I think that's one of the things. I know, Steve, you're next, and we're going to talk a little bit more about the Respite Relief Program. Steve is the CEO of the Elizabeth Dole Foundation. And from your experience, as I said, respite can be life-changing, but it can also be really difficult to accept. And it can be hard to get yourself to the place where you say, okay, I'm going to take some help. I know, because it's been times when I was overwhelmed, it almost seemed too complicated to try and get more help, but it was what I needed the most. So tell us, I know I'm not alone in that feeling. Can you explain why caregivers hesitate to accept respite care, and how we can all help them get that help that they really are eligible for and that they need so much?
Amy, thank you so much for that important question. I want to thank Blue Star Families, Kathy and her team, And speaking of transformative, I want to thank the transformative Sherwin Sheik for his leadership in not just committing to this respite program, but to challenging the nation to step up, because we have another transformative partner on this call today, and that's Wounded Warrior Project, who stood up and matched CareLinks' $1 million commitment with $1 million commitment of their own, which ensures that this program to provide these hours with the VA will continue straight through this year and into next. And Sherwin, Alex, the team at WWP and EDF and at the VA, we're all learning together what it means to field a national respite program. Sherwin and his team provide in-home care better than any company in the country. I might get in trouble for saying that, Sherwin, but it's true. And Amy, what we've come to understand about respite is there are wide misunderstandings about what respite means. Part of people's hesitation to avail themselves of this service is that they've not wanted people in the house. Meg mentioned a reluctance for folks to have people come in. Now the world is beginning to open up. Last week, the CDC announced that folks indoors and outdoors can keep their masks off. We're hopeful that the reemergence of society will create more opportunities for Sherwin and his team to get in many more homes across America. He's more eager than any one of us to provide this service because, as you heard, once people go through it, they're giving us close to perfect ratings. They're rating their health like by double, improvement in their health ratios. We're seeing people avail themselves of services and support from the VA quicker as a result of this program. They're more apt to reach out to mental and emotional health specialists. And then Sherwin and his team are asking a whole series of questions to folks who are receiving respite about additional needs that they have, so that partners like Wounded Warrior Project and the Independence Program, which Alex and his team oversee, can provide wraparound services for families who need it. So this is actually more than just a respite partnership. This is an opportunity to go in and provide life-saving care, a life-saving lifeline, a listening ear. And folks, what we need you to understand, who are watching, is that this means a helping hand. This means if you need help cleaning up the house, this means if you need a break just to get out and get your hair done, or do some grocery shopping, or take a walk. We've created a program with Wounded Warrior Project and with Sherwin and the CareLinks team and the VA that allows you to manage the hours as you see fit. It allows you to choose the kind of help that you need, the customized help that you need. And the folks that are coming into your house are the best trained in the country. Something else that has been really gratifying for me to see, Amy, is that the folks who Sherwin is sending in are telling us that they love going into these military households and these veteran households because they get perhaps even more than what these households are getting in terms of service and support, the gratification that these care workers are receiving by supporting these vulnerable families. So it's really just, it's here to stay. Sherwin and his team and the Wounded Warrior Project team and the VA team, we speak on a super regular basis to track the program. We're doing a lot of work to market it to every corner of the country. So if you haven't heard about it, go to hiddenheroes.org/respite and do an application. We've got full-time people who can answer questions, a website full of information if you need it. And I just want to thank those who've taken advantage of this service. They're the best advocates for their peers to sign up. And we're going to be sending out those testimonials as fast as we get them. But help us spread the word about this literally boots on the ground, real-time support and service that's available free of charge due to the incredible support of CareLinks, Wounded Warrior Project, and our friends at the VA. And just as I close, Amy, I want to give another hat tip to the Department of Veterans Affairs for the innovation, openness, and energy that they've demonstrated responding to this pandemic. Meg, Colleen, and from the secretary on down have been just incredible partners to all of us who are providing hope, services, and support to those who need it right now. And we're not done.
Absolutely. Yeah, there's much to be done, but I think it's a great accomplishment. And as you know, AARP has been really dedicated to helping spread the word about the respite relief program. And we had, I hosted a Facebook Live chat in the AARP Family Caregivers discussion group on Facebook with one of your fellows, Elizabeth, and she shared how she had kind of been hesitant to actually take advantage of the respite relief, but when she finally did, it was just, life-changing for her and helped her to do some things. She didn't even know what to do with herself at one point, of the relief of having some time. But the other thing that we heard a lot was, as you say, people may not want to have someone come in the home, but they can run errands for you. They can go to the grocery store. They can sometimes do housework or yard work, or, cook a meal for you. There's so many things that these respite workers can do, right?
If I could say one more thing, these are folks who are trained to know how to equip themselves, how to protect you, how to navigate this pandemic and the circumstances and dynamics that you may be facing with your injured loved one, with your aging loved one. Sherwin and his team are the top. They go through, incredible intensive training to create a really warm, nurturing environment and exchange. There are friendships created as part of this program. And we wouldn't have been able to do it without our great friends at AARP and just the incredible diverse partners who come together to help us spread the word. Amy, I got to tell you, I signed up for my AARP membership over the last year, and I've quickly learned how many benefits there are from being a part of your family as well. So we thank you for everything that you're doing.
Well, congratulations, Steve. Welcome to the club. I'm going to move on now to Dr. Alex Boesler. He is the Director for Warrior Care Network and Independent Services at the Wounded Warrior Project. The Wounded Warrior Project is focused on direct programs and services for injured and ill veterans. So how does support for the caregivers fit in with the organizational mission? The caregivers are taking care of our injured and ill service members.
Well, thank you, Amy. I appreciate the question, and thank you for this amazing panel here, who I get the fortune of working with on almost a daily basis with many of you all, or interacting with you all in some regard. And I also want to say that this is obviously my profession, working at Wounded Warrior Project, but it's also deeply personal, as I've served with many of these warriors and their families who've answered the call, and getting this opportunity to work with them and their caregivers is really it's really an honor and a privilege to work with them. So thank you. So as it relates to Wounded Warrior Project and our programs that we deliver for our families, our mission here at Wounded Warrior Project is to honor and empower post 9/11 wounded warriors and their families. And in September of last year, we really decided to kick in our support for caregivers, knowing what has transpired over the last year and a half with COVID, and how it's exacerbated some of the issues with caregiving. We felt it was our obligation, and we announced an investment in caregiver relief for those caregivers, specifically in our independence program. Our goal was to provide them immediate assistance, but also to start and help them plan for the future as well. Currently, our independence program serves 720 warriors and their caregivers. In many of these cases, it's a single caregiver or a family of caregivers who are really at the front line of empowering and assisting these independence program warriors. They have an obligation to meet the needs of that warrior, but there are also so many unanticipated or unplanned needs for these warriors. But they also must adjust and adapt to care for other family members as well. So they tend to put aside their own care and wellness in support of their warrior and their families. It's really quite noble what all of these caregivers have done. So what programs did we roll out last September? Specifically, we started off with a nearly $2 million direct grant, a total sum of $2 million of direct grant for independent program caregivers. That was about $3,000 per caregiver in our program, which would help them offset any current needs that they have right now, and really provide that stepping stone for them to start their own personal wellness. Most of our caregivers spent the money on personal care. They also spent that money to meet any additional financial need that they have, and also supported themselves with the purchase of some recreational or some goods and services for their homes. So you can see where these caregivers are really looking, to improve and better their home and community lives. Additionally, as Steve mentioned, Wounded Warrior Project donated $1 million in grant support, which translates to 35,000 respite hours for the respite relief for military and veteran caregivers program. That's truly amazing, and many of the caregivers that we work with have taken advantage of that particular program. So thank you, Steve, and thank you, Sherwin, for making this opportunity possible for us to continue to support past September of last year as well. And so, as I mentioned, the $3,000 grant that we gave, that was the stepping stone, but we also wanted to provide additional wraparound services for these caregivers in the form of direct program delivery. We know that managing personal care, daily tasks, and providing respite is really important. So that's something we really focused on, and we were able to, with an additional $4 million investment through our leadership here at Wounded Warrior Project, we were able to promote and purchase respite and secondary support services. This allowed us to provide even more skilled care nursing for skilled care assets for our warriors and their families. We were also able to purchase meals, housekeeping, all these other services that really go to support and offset some of that work that caregiver provides for that family. We also were able to give these caregivers an opportunity to help promote their own self-care. Right? We offered a digital app-based solution called NeuroFlow that really helped them take control of their own personal wellness and well-being. The app helps provide them self-guided wellness techniques, breathing, mindfulness, a variety of coping strategies. So it's not just Wounded Warrior Project and our direct services providing, it's the opportunity to use technology to help them help themselves as well. We also built some programs related to engagement. Caregivers want to engage with each other, and we know the time is tough right now, but the virtual platforms that we've developed to help support and bring them together has been quite remarkable. Our virtual programming, which we call VIP, the Virtual Independence Program for Caregivers, it really has allowed us to bring and really affect some amazing change in the behaviors of these caregivers. Specifically, we developed a program called Operation Rise, and it was specifically designed for caregivers. The program is a 4 weeks worth of sessions, providing information, resources, some psychoeducation around respite, around wellness, about your mental health and well-being. And also it brings these caregivers together, which is uniquely important. And in December, we hope to bring back all of our caregivers who participated in this program in an in-person event. So it's going to be like an alumni event for these caregivers who participated in Operation Rise. And we also look to directly address the mental health needs of these caregivers. So we were able to provide additional funding to support treatment for addiction, non-PTSD types of counseling. So we're looking at anxiety and depression provided through some of our partners. And almost all of these sessions that we delivered were done via telehealth, which was truly a remarkable accomplishment, something we've really learned to leverage over the last year and a half considering COVID. And finally, another program that we have here, and it's really more of our legislative affairs and legislation and advocacy side of what we do at Wounded Warrior Project. And I would be remiss if I didn't get a chance to talk about the work that they do. Wounded Warrior Project has been a champion for the program of comprehensive assistance for family caregivers. We helped pass the original Caregiver Act many years ago, and we do remain committed to serving those veterans and their caregivers through our advocacy and programs that we deliver at Wounded Warrior Project. Wounded Warrior Project has always been very instrumental in helping extend the current version of the program of comprehensive assistance for family caregivers to veterans and caregivers of all generations. It's very important. We are committed to making the caregiver community bigger, better, and more and better off than they were in the past. And moving forward, we continue to be good partners with the Dole Foundation, partners with our friends at RCI as well, to really ensure that the needs of this caregiver generation, specifically the post 9/11 caregivers, are met. And we are excited about the work that we've done this fiscal year, and there's going to be a lot more to come next fiscal year as we're going to leverage a lot of lessons learned. So thank you for your time, and I appreciate this.
Oh, you have been busy. It sounds it's amazing all that you've been getting done, and all that you've done, especially in the past year when there have been so many extra challenges with the pandemic. I love your use of technology, that you're helping caregivers both connect with other caregivers in similar situations, because we do learn the most from each other and we get the best support that way, but also the app that you described that helps with the wellness and mental health and mindfulness and meditation. Those things I know helped me immensely as a caregiver, and talk with caregivers all the time who are trying to understand and learn how to do that. And so I think that's a fantastic development, along with all of the other great supports that you're providing. And, you know, hearing you talk reminds me of how all of you, we all work together, right? It really is a team and such a great collaborative efforts among all of these organizations to be there for all of you who are caring for your service members and veterans. So be sure and check the chat as we're talking for links and websites and how to find these resources and these programs that you're hearing about. I'm going to move on next to Dr. Jennifer Olson, who's the Executive Director of the Rosalind Carter Institute. Again, I'm a big fan. The Rosalind Carter Institute has been a long time advocate and support for family caregivers. We know that Blue Star Families and RCI have both heard a lot about how caregivers are more stressed and more isolated than their non-caregiving peers. And it's all magnified. It's particularly true during the pandemic. A greater proportion of active duty caregiving families reported that COVID-19 had a major or severe impact on their overall happiness, their mental health, their personal health, than their non-caregiving peers. So that aligns closely with the findings that you've had from RCI's Caregivers in Crisis report. And through your Operation Family Caregiver program that focuses on the caregiver's mental health, RCI states that caregivers are more content, less depressed, and in better health. Those are great results. So how does Operation Family Caregivers help? What is the key to that incredible success, really?
Well, thank you, Amy, and thank you to the Blue Star team for having me today. Our Operation Family Caregiver program comes from a decade of work building off of Ms. Carr's longstanding focus on caregivers. This is a coaching program, a one-on-one coaching program, and I think the key to it is twofold. It's focused on problem solving, and that can be anything from, you know, finding the resources that exist through many of our partners on this call today, to making a decision for yourself to go back to school, or making a decision to figure out how to get respite if you've been pondering it and looking at websites, but thinking it's too complicated. And we think that by helping people learn new approaches to problem solving, that will help them not just while they're in our program, but far beyond. We all know that the caregiver journey can be years or decades. And so we see this as a critical aspect of why the program's so successful. But the other is the connection, connecting one-on-one with another person who's been through lived caregiver experience, especially the military caregiver experience, is invaluable. Many of our caregivers talk about having somebody to laugh with and to cry with as they go through their journey. And so we're really excited that we've kind of taken our one-on-one approach, and with our partners at Wounded Warrior, thought about how do we apply that to small groups? How do we think about different ways of delivering programs that build that connection, not just during the program's duration, but for the long haul?
Yeah. Oh, it's such incredible work. And as you say, being able to take the learnings and spread them and apply them in different ways and help family caregivers connect with each other and really address these mental health issues. It's amazing the work that you've done and the progress. I look forward to hearing about more as that continues. And to all of you who are watching, you've been seeing below some of these resources and websites that we're talking about. Be sure to check the chat as well. And then you can also check the Blue Star Family's website as we go along. I want to thank all of you, amazing people and amazing organizations, for joining me today for this. This has just been a fantastic discussion. I wish we had a couple more hours so we could go back and forth a little bit more and learn and hear from each other a little bit more, but we'll have to save that for next time. All of your insights are just so invaluable to the caregiving community, and all these resources are going to be extremely helpful for people. AARP, as I mentioned, is dedicated to supporting all caregivers, in particular military and veteran family caregivers, and we have put together a lot of resources. So I just want to make sure and share those as well. If you go to aarp.org/veterans, you're going to find all of these resources for veteran and family caregivers. You'll find some of our top things. We have a military caregiving guide that we did in collaboration with the Elizabeth Dole Foundation. We have a new financial workbook for veteran and military family caregivers. And we have, of course, the Facebook group that I mentioned before. Several of you have mentioned the importance of connecting caregivers with each other, because we provide so much support that way, whether it's laughing or crying or problem solving and helping people vent. And we have more than 6,000 members of this group now. I moderate the group. I'm in there every day, and people are amazing. I think we all lift each other up, and I'm really proud of this group because it's kept a very positive and supportive attitude. So you can find all of these resources at aarp.org/veterans. And Kathy, I'm going to hand off to you. Thank you so much for inviting me today. This has just been such a great discussion. I'm so happy to be a part of this. As you know, this is truly an issue of the heart for me, and I love being able to speak with other experts who are as passionate about it as I am in supporting our hidden heroes. Speaking of which, I know that Blue Star Families also has done a great deal to support the military caregiver community. Can you tell us a little bit more about those efforts?
Absolutely, Amy. I'd love to. But first, I have to really thank you for leading today's discussion. That was just fantastic. I know I actually learned a lot myself, and I always love the opportunity to work with you. And now to answer your question, I'd be remiss if I didn't share Blue Star Family solutions to our military caregiving pain points. We learned through our research that military caregivers feel even less of a sense of belonging or connection to their communities than do their non-caregiving peers. And that's why we developed two well-researched and impactful programs. And the first is our Caregivers Empowering Caregivers program. It was created to honor, recognize, and support military and veteran caregivers. The goal is to empower caregivers and provide them with tools and resources they need to thrive. And that's through social events, online support groups, opportunities to engage with other caregivers in their community. Our caregiver coffee chats are part of that. They're opportunities for caregivers to just take a little bit of time for themselves, join a monthly coffee chat at the local Starbucks. The chats are tailored to the needs of our audiences, of our participants, and they're tailored to the local resources right there in that community. And really, they're also about just developing a new friendship over a cup of coffee. It's a simple thing, but it's a meaningful thing. Anyone on this call can find a link to Blue Star Family's Caregivers page below. If you're a caregiver, please join us. Empower yourself and others in your community, as we learned in this panel. Having a support group and time for yourself is extremely important to you as an individual and as a caregiver. Amy, thank you again for sharing your time with us today. You are a wonderful moderator and a passionate advocate. I look forward to continuing to work with you in support of our military caregivers. We're also so grateful to our partners at the Department of Veterans Affairs, CareLinks, the Elizabeth Dole Foundation, the Rosalind Carter Institute, and Wounded Warrior Project. Thank you all for your support of this great event. We are grateful that you shared your time and insights today. And finally, thank you to not only Amy, but all of our friends at AARP. We have done so much together in the last year, and I look forward to continuing our collaboration with you in the future and to continuing this important work. And for you, our attendees, thank you for joining us today. We hope you found the panel discussion helpful. It was so much information. I bet your heads are spinning, but don't worry. You can find all the resources mentioned here today just below this video on our website, and we will send you a link to all the resources we discussed today in the post-event email. So please take a few moments to fill out the post-event survey that helps us do a better job with these as we move forward. Help us better serve you. That's what we're here to do. I wanted to mention, too, that our friends at the Elizabeth Dole Foundation and the Wounded Warrior Project have teamed up with the Biden administration's Joining Forces program to launch an amazing program called the Hidden Helpers Coalition. It's a community that will focus solely on the children of military caregivers. This is an issue that I care about deeply. We need to pay more attention to our military kids. This coalition will call out partners to take action and fill the gaps in support for this special part of our military caregiving community. It's a group that bears many more burdens than their non-caregiving peers, for sure. It's a group that deserves our attention and our care. Blue Star families, all of us, we are very excited to be part of this important work, and we really appreciate the leadership behind this. We've shared the link in this chat and also the resources below so that you can learn more. Now, to close out today's event, a little fun. We have put together a special thank you to our caregivers from all of us gathered here today. In celebration of the month of the military caregiver, we surprised 5 military caregivers who are with us today with a special gift and gift card to treat their family to get dinner. Blue Star families, AARP, and all of our partner organizations represented today are dedicated to supporting our caregiving community. And we are excited to celebrate these special caregivers with our friends gathered here today. Thank you, caregivers, for all you do.
I just want to thank Blue Star and the partners for sending me this beautiful edible arrangement. Thank you so much, and happy Mother's Day to everyone.
I was so excited when I opened the door and I saw this lady outside with this edible arrangement. I was so excited. I'm like, another gift. Thank you for my Blue Star Family Caregiver Support Group. Thank you.